Good Wednesday morning, and thanks for joining us. It is May 8th here at 9 o'clock, and appreciate you joining us here for the next installment of Your Mental Health Connection. I'm Brendan Kinney with UpNorthLive News, and we have a new face and a familiar face. We've been doing this all year long here. We'll say hi to Erica and Curtis, Dr. Cummins. Appreciate you joining us. Erica, if you want to start with an introduction.
Hi, I'm Erica Longstreet. I am the Operations Manager over the Access Department here at Northern Lakes Community Mental Health.
And good morning, Dr. Cummins. If you can introduce yourself to us, please.
Hey, hi, all. So, Kurt Cummins, Medical Director for Northern Lakes CMH, and we're calling from our Traverse City office.
All right, good deal. And I think that's a great place to start for people who are not aware of Northern Lakes Community Mental Health. Talk about the services you offer and also how you cover all of Northern Michigan. Talk about that regional coverage you have, please.
Yeah, so Northern Lakes Community Mental Health, we exist to serve the Medicaid population. We cover 6 counties: Grand Traverse, Leelanau, Wexford, Missaukee, Roscommon, and Crawford. We have 4 locations in Traverse City, Cadillac, Houghton Lake, and Grayling. We primarily exist to serve the most severe population. So that could look for adults, a severe to profound mental illness. For children, that could look like a serious emotional disturbance. And across the lifespan, individuals who have an intellectual or developmental disability.
And with it being May and Mental Health Awareness Month, we're just going to kind of go between the two of you and can answer whatever question you feel comfortable answering. We'll talk about Northern Lakes Community Mental Health and what does the eligibility criteria look like?
Yeah, so again, we are a Medicaid entity. So we primarily serve those who have Medicaid insurance with some exceptions. My team is comprised of 8 clinicians. So anybody with any concerns of mental health can give us a call. Our 800 number is 1-800-492-5742. We would complete a pre-screening to determine eligibility for an initial clinical assessment. The initial clinical assessment can last up to 2 to 3 hours, and this would be to determine eligibility for ongoing services. So again, my clinicians are trained as mental health professionals to assess for that severity level. And we do utilize, we're looking at symptoms that are derived from the Diagnostic Statistical Manual, as well as impairment to functioning, substantial impairment in functioning.
And what's the population that you serve?
So again, for adults, that would be severe to profoundly mentally ill population, or SMI, severely mentally ill. Children, our population, we're looking at serious emotional disturbances, and across the lifespans, those who have an intellectual or developmental disability. Again, we're looking at 3 areas of substantial limitations in their life.
Mm-hmm. And then in terms of the services provided, if you can talk us through what does that service delivery look like?
Yeah, so my clinicians, we can complete access screenings by phone or as a walk-in. If somebody's not comfortable calling us by phone and disclosing some very personal information, I would encourage them to come in as a walk-in to any of our 4 locations: Cadillac, Traverse City, Houghton Lake, or Grayling. And then for the initial clinical assessment, we conduct those primarily in person, with telehealth being an option as needed, so we could connect to them virtually.
And then that answers the next question in terms of how people can access you and access the services as well. Phone, virtual, it sounds like. In person, there are a lot of different ways, it sounds like.
Yes.
And then if concerns of mental health exists with anybody watching or family or a friend, what should that person do?
I would encourage them to give us a call. If ever in doubt, call us. Like I said, my staff, we are trained mental health professionals. The screening process is free, so we could certainly rule out whether or not they are needing an assessment. If not, we could help them find community resources that best fit their their need. But if ever in doubt, just reach out.
Good deal. That makes sense. Now, looking for, obviously, people in your office would know this answer, but I think even for me, the general person, it may be a little complex, a little confusing getting into all this. If you can talk about the difference between a psychiatrist, psychologist, and also a clinical therapist, please.
So a psychologist, we utilize our psychologists here are trained in completing psychological evaluations that oftentimes are ordered through the court in determining guardianship or a final diagnosis for intellectual or developmental disabilities that could include autism. They are trained specialists in these tools to within their scope of practice to clinically be able to complete psychological evaluations for specific diagnostics. A psychiatrist, such as Dr. Cummins, is a medical doctor who is trained and able to provide medication management and evaluation. And a trained clinical therapist, we comprise of a team of social workers, licensed practicing clinicians or counselors, who are trained in the mental health field to provide therapy services and psychosocial assessments.
Mm-hmm. I appreciate that explanation. That's definitely helpful. How would somebody know when they need these services?
Again, I think it goes back to just give us a call and we can help point them in the right direction.
And then, Dr. Cummins, you can chime in whenever you want to share your knowledge. Next question, can my primary care provider prescribe medications to treat the mental health symptoms?
Yeah, absolutely. Actually, the majority of, let's say medicines like people have heard of Prozac and Zoloft, medicines that are around a long time since the early 90s. So typically primary care providers are pretty comfortable and trained to treat, let's say, depression or anxiety disorders. When I say anxiety disorders, I'm thinking, obsessive compulsive disorder, panic disorder, just various anxiety disorders. So absolutely, primary care providers are, a great first step to kind of get that care that people need. They don't necessarily need to see a psychiatrist. A lot of times, the majority of the care is delivered in the primary care setting. We are a behavioral health, specialty clinic. But that being said, for those people that are not seeking out our services, there are, any primary care clinic that you have throughout a region or throughout the U.S., of course, that's where a majority of the behavioral health care is being provided, at least on a per number basis, so to speak.
And if somebody's prescribed a medication, when can that person start feeling better?
Oh, good question. Well, it depends on the condition and the nature of the treatment. So that's a great question. Let's say, when people may not know this, like sometimes if someone's being treated for depression or put on an antidepressant, and usually you might see results in 4 to 8 weeks, assuming that they're going to respond to that. So it does take time. And of course, you want to educate the people that you're treating to that. And, it's possible that people may have a partial response and they may need to wait longer or maybe a change in treatment, but it does take time. That being said, there are some medications that, let's say, that are used for other health, let's say with schizophrenia or bipolar disorder, you might have results within 1 to 2 weeks. So it really depends on the nature of the illness that you're treating and also then the nature of what you're providing at that point in time. So it all depends on getting educated and doing a good job as a provider of that and letting that person know. So it is quite variable.
Mm-hmm. When it comes to possible referrals, possibly from a primary care provider over to psychiatry, when should that primary care provider consider that possibility?
Good question. I think it depends on the provider specifically, because maybe somebody's very, very well adept and pretty comfortable managing, let's say, even people that we serve, who are severely mentally ill. So a lot is going to rest on the training and the experience of the provider itself. But, that's a fair question. So, it also depends on what your resources are locally. If you are, let's say, in rural Michigan, which is definitely part of our 6-county footprint, it's going to be maybe look a little bit differently. Maybe that provider is pretty well adept in managing those conditions versus, let's say, you're in a an academic hotbed, let's say like Southeastern Michigan, you might actually refer to psychiatry sooner. So again, it really depends on the provider itself. But to close the question, I would say if you're feeling like if you're receiving that care from somebody and you feel like you're not getting the results that you're hoping for, start with a question like, should we consider a referral, or what does the referral look like? What kind of what additional help can I expect to receive? Do I need to have change in treatment, or maybe do I need to have therapy in addition to medicines? So it begins with a conversation.
And when should somebody consider going to an emergency room for an evaluation?
Geez Louise, that's a great question. So it really depends on, people, because I work at Munson Medical Center and I'm on staff there, so I will sometimes see people in the emergency department. But ideally, you're going there, of course, if people go there in emergency, a mental health emergency, right? And if you're feeling unsafe, or feel like you need get an assessment in an urgent manner. As an aside, as the people or some of our community members may know that, our agency, NorthLake CMH, is working in partnership with Munson Healthcare and building out right now it's coined the Grand Traverse Center for Mental Wellness, but we do hope to have a 24/7 alternative to the emergency room. That being said, that's not going to come online until later this year, early next year. So, when should I go to the emergency room? Gosh, if you're feeling like you're in a crisis, you can go. And alternatively, you can also call. We do have like a mental health crisis services team at Northern Lakes that potentially could come to you to address those issues. So if you feel like you need to go to the emergency room, do so. But you also potentially call their crisis number, or you can call 911 or 988. Actually, it's the national number now that's been put out for mental health crisis. So there's a number of resources that are out there.
Mm-hmm. Now here's another scenario. What if my loved one is mentally ill? I want to get them treatment, but they're not willing to go. They're not willing to get treatment. What should I do?
Well, I'll take that one. Is that okay? Yeah. Good question. It depends, I guess, on the severity. Let's say somebody you just know is struggling, right? And they're not wanting treatment, and I guess begin listening and supporting that person, right? And maybe you can be that person that, you just try to, as long as there's no urgency, right? So I'm just beginning with somebody that you're just concerned with and they're not wanting treatment. They don't really, maybe they acknowledge they have an issue but don't want to get help. Just continue to support them, whether it be with a conversation, a phone call, and maybe you can be that person that helps them get them to their, let's say, primary care provider to begin a conversation. Or maybe you're the person that helps them get on the phone to call Northern Lake CMH. So I guess just kind of being there, being supportive to help that person maybe get to that next, but yet very important first step to kind of begin that conversation with somebody else.
Mm-hmm. Is there anything, Erica, you wanted to add on top of that, or anything else we've been talking about?
Yeah, I just wanted to piggyback off of that. If it's an individual in a crisis where their loved one feels that they are unsafe, we do have that after-hour crisis line as well that they can call. That number is 833-295-0616. And we could potentially meet with the loved one in the community to help with a petition process if that's what is needed in order to keep the individual safe.
Mm-hmm.
I could actually add to that, because let's say you have somebody that doesn't want to have a conversation with you, but yet let's say you definitely know that they are really struggling. Maybe there's some concerns for risk. Then I would encourage their loved ones or concerned ones to call us, because there are options out there for civil commitment, which is of course a whole other topic. But under the state of Michigan mental health code, there are procedures to get people into mental health treatment through through a court hearing. It may or may not include hospitalization. And that's just something that statewide there's an initiative to kind of utilize more assisted outpatient treatment orders, which is an evidence-based practice to really help primarily those people who really are severely mentally ill. And, think about people with schizophrenia, bipolar disorder, severe depression, that are at risk for homelessness and repeated incarcerations. But that being said, again, to go back to the question, call us too, maybe give you people resources to explore if that's an appropriate venue or appropriate line to take with somebody that you feel like is at risk.
I've done a great job talking about the resources available at CMH. I'm curious to know any other additional resources in the community to support those who are wanting mental health counseling, advice, anything like that.
Yes, there are amazing resources in our communities, scarce in the Southeast region, but they do exist. They are mental health professionals as well who can provide therapy services, individual and group therapy. As Dr. Cummins had stated, psychiatry options in Northern Michigan are a little more scarce, but we have seen an increase help through telehealth. So we are able to provide resources for doctors, psychiatrists downstate that can meet with consumers or individuals who are needing psychiatry virtually.
And I would add that, there are a number of primary care clinics in our region. I'll give a shout out to, the Traverse Health Clinic in Traverse City, off of Garfield, Northwest Michigan Health Services, up behind West Bay Times in Traverse City, Mid Michigan Health Park in Houghton Lake, and then Family Health Care in Cadillac. So those are all federally qualified health clinics. And what is that? Those are clinics that have, of course, deliver primary care services. They have behavioral health specialists. They have dentistry typically sometimes included. So that's one place where you can get behavioral health services and also primary care services potentially in one spot. So there are, in addition to what we offer, there are different models out there that provide behavioral health services in your local communities.
Mm-hmm. And with this being a live segment, there's my friend Susie Q. She watches all of our Facebook Lives, but she's saying, so nice you're helping people who need this care. Thank you and God bless you. And I second that. Thanks for all the work that you're doing in our community. We appreciate that.
Our pleasure.
Yes.
Obviously, we covered a lot. It is Mental Health Awareness Month. Is there anything else you want to talk about with you being the specialist in this field?
Oh, I would just say thanks for the opportunity for allowing us to shine a light on this important issue. Obviously, it's May is a special month, but of course, we're doing this 365, 24/7, and just advocate for people to kind of get the help that they need. So thanks for the opportunity.
Yes, thank you.
Erica, anything else you want to close us out with today?
No, just to reiterate, mental health can be quite complex and confusing for many people. So I would just like to reiterate, if ever in doubt, reach out, and we can provide the help.
And I can see our numbers are growing, people watching. So if somebody is just tuning in, what's the best way for somebody to get a hold of either you, Erica, Dr. Cummins, or anybody at Northern Lakes Community Mental Health?
The hotline to our access department is 1-800-492-5742. The after-hour crisis line is 833-295-0616. Our offices are located in Traverse City, Cadillac, Houghton Lake, and Grayling. I would encourage anybody not comfortable to make the call because we do oftentimes discuss very private information that is sensitive. I would encourage them to walk into one of our 4 locations.
All right. Well, thank you so much for your time on this Wednesday. Appreciate it.
Thank you.
Thank you.
All right. Bye-bye.